One of the things that NCS has been doing is looking at things like hospital episodic data for the areas that we're working in, really to try and get some greater clarity on how people are using hospital services and where better quality and efficiencies can be made. It's really important to understand how hospital services are being used and try and make some efficiencies there, because very often patients are going into hospital as a result of a crisis, and if we could provide better care in primary care, we can avoid that and of course provide better quality for the patient and greater efficiencies for the NHS services.
So what kind of numbers are we talking about?
We're talking huge numbers. If we look at, for example, elderly care appointments from a geriatrician, many patients with Parkinson's disease will see a geriatrician. There were 193 outpatient appointments, first visit outpatient appointments in 2010 from a geriatrician. That's a cost of £51 million. It's a huge amount of money. Follow-up appointments are a similar size. We've got over 303,000 follow-up appointments for geriatricians at a cost of £39 million. These are huge figures, and if we look at having a more appropriate workforce, so for example putting some skill mix into the workforce, so Parkinson's disease nurse specialists could see patients for follow-up appointments rather than it being a doctor, we could make some cost savings there and provide better quality care. Patients themselves really value the Parkinson's disease nurse specialist, and I think if we could ensure that everybody has access to a nurse specialist, that would be a fantastic achievement.
So what kind of numbers might a Parkinson's nurse bring?
In terms of outpatient appointments, well, if we're looking at cost savings, we've got one area that we worked in where the nurse did follow-up appointments over a 12-month period rather than the geriatrician doing them, and made £144,000 worth of cost savings there. So it was a huge amount of money that could be reinvested into the service to provide other different aspects of services that were the area thought that they couldn't afford, like the multidisciplinary team.